being a dental practice owner can be totally nacho nuts. I know because I am one. This is Paul, Dr. Nacho Goodman, founder of Dental Nachos and Dentist Job Connect. And this is Talking Nachos, where we help the dental community do three things through our fantastic sponsors and supporters: increase success, decrease stress, and most of all, feel like you want to cry less inside each day. This is the Cry Inside Monster. I am talking to a fellow introduce himself who is so on brand, already eating nachos on Talking Nachos. So I truly appreciate that nod to our brand. Could you share with us who you are and what you do to help dentists?
Yeah, absolutely. I'm Dr. Weston Spencer. I am CEO of SPP Dental Partners, a group that we started in Southern California to save private practice. That's what SPP stands for. I'm also a 4-day-a-week private practice owner as well. So we built this group to look after and provide the private practice experience while still being part of a group.
Well, I always bring this basketball, Weston, and you are truly the player coach, right? You are both playing the game of dentisting and also coaching. Let's dig into a few things. I want to tell everyone that they can text SPP to 215-543-6454 to get connected with our sponsor. Before we dive into that, I just want to ask, do you have conversations with dentists at all different ages and stages? Is it totally cool for our community to reach out and say, hey, Weston, I just want to learn a little more about the direction private practice is going, what I'll call kind of
Absolutely.
like casual conversations about the future of private practice. Is that cool with you?
Absolutely. No, we are very transparent, easy to reach, and happy to talk to anybody at any stage of their practice career.
Awesome.
I would say, and within our group, the majority are kind of probably in that anywhere from late 30s on up to like 50s. And we even have one or two doctors that are pretty close to retirement as well.
Awesome. Now, you shared something. And when did you graduate from dental school? I graduated in 2010.
2010.
I'm 2002. So same generation as. What is it about private practice that maybe needs saving or needs collaboration? Or what kind of challenges do you see? Be as genuine, authentic with us as possible. Talking Nachos is also about
Yeah.
educating our community.
What, let me ask you this, Paul. What percentage of dental field or dental industry together as a whole is consolidated at this point? What your number?
My number is going to be 15 to 20%.
Way higher.
Now,
It, it's way higher.
share with me more about that.
Yeah. So the reason why we don't get a lot of the data as just general dentists from the ADA and a lot of other places is because they're not accessing a lot of up-to-date numbers on how many people, especially in the last 5 to 6 years, have either joined a group or sold to a group.
Yeah, I
And
mean,
that number
I
is
just say,
much.
you go to different events and they always
Yeah.
come up with different numbers. And I've
Yeah.
always thought to myself, there's no required reporting for saying, hey, I just
Mm-mm.
started to assist. So what's the number is most
High
accurate?
30s.
High
High
30s. Good.
30s is more accurate of how many dentists have joined and we're talking part of essentially not just the solo practitioner that own probably either themselves own multiple locations or part of a group that owns multiple locations. Okay, so when you look at that field and see that like that is where so much is going, it puts pressures, and we've seen some of those pressures happen in other fields. And so we're learning from some of those pressures. And what does that do to the private practice owner, right? What does that make them see? When they see a bunch of their colleagues have joined other groups, all of a sudden, and naturally as dentists, don't you kind of be like, well, is that right for me? Should I be doing that? What's going on? You start to think about this. Is that affecting my day to day? Am I feeling the competition from that? Those kinds of things. So when you ask me if there's something worth saving, the experience of being a dentist and being able to control what you want to do, when you want to do it, having that autonomy, being the majority owner of your practice, you setting the culture every single day, who you're going to hire, who you're going to let go, all that kind of stuff. At the end of the day, I know is stressful and hard for everybody. That's the not so fun about being private practice owner. But the good part is that, yeah, I'm still in control and I still get to have a say in that. And that's ultimately what we're trying to preserve, is that if we're going to go somewhere as a group together, let's build it. Let's put our money where our mouth is and build it in a way that people can have that true autonomy, because that's what we're not going after. We're not going after a majority ownership or partnership in
So that I
people's
want to highlight that part.
practices.
And what we do is I shared with you I believe Dental Nachos is an amazing community, like a Google, like a Reddit, like a platform for people to learn about things they didn't know existed before, for people to get context and awareness of what's this whole DSO DPO thing, what's the
Yeah.
deal with private practice, Tell me, just highlight, you don't purchase a majority of the practice. What
Correct.
is your why behind that for your group?
To say what we said we were going to do, which is like reserve the majority ownership to the dentist, right? It's
So,
really hard at the end of the day for me to truly tell you what to do. And that's not my goal anyway, because I'm a dentist and I don't want to be really told what to do on a day to day if I don't own the majority of your practice,
so the
right?
dentist retains majority ownership. Now you've built this group. Tell me some of the, it's okay for dentists to be happy. Sometimes after dental school, we think it's illegal for us to be happy, right? We should just be thinking about our crown prep taper and how we failed everyone, right? But it's
Mm-hmm.
okay for us to be happy. Talk to me a little bit about your group. What are some of the benefits of being part of a group professionally, personally, being able to ask
Yeah.
questions? Put aside money, put aside EBITDA, put aside saving on supplies, maybe just the fact that you feel like you now have 10 plus dentists that are in your corner. How has that shown up for
Yep.
you as a practice owner?
Yeah. Talk. That's camaraderie, right? Like having everybody, all of us who've been part of a mastermind group, we join those mastermind groups, right? Because we want that
Yeah.
camaraderie. We may not all think alike, but because of that group, we learn from each other and we can be vulnerable with each other and say, hey, I got this thing going on. What do you guys think? And everybody's going to like, back you up and help you out. Imagine that, but through an actual partnership. Like
Yeah.
I want you to succeed. You want me to succeed. So that exists, right? So even though not all of us are super close, some of us are. Like we have six locations just right in the Southern California area that we'll get together through a study club, and we'll do that virtually, so everybody else can be a part of it as well with us. But so camaraderie is one, right? And then the other things that like the actual when trying to support dentists through specific types of services, right? Billing, marketing, HR, supply, those
Yeah.
kinds of things. Like feeling like I've always tried to preach, no matter the size of your practice, um, being able to outsource certain things so that your practice can focus on
Right.
really good patient care is a really important aspect of so-called scaling your business, right? Because everybody talks about like, oh, how do I scale? Like, how do I build a business that over time is kind of starting to build itself and doesn't rely on Janine, who's always done my billing and sits in that corner.
Right.
And when Janine gets sick, or heaven forbid, she either wants to leave or can't work anymore, I'm out. I'm toast.
I actually, what you're sharing is, my own father was a dentist, amazing friend, amazing mentor. Sadly passed away in 2016. But he had a close friend who was a very, 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 very good dentist, but very, very high strung. And he had a really big practice. This was, and his office manager quit and he sold his practice just because he said, I don't want to get a new office manager. But I
I
actually
know. Yeah.
understand that pain. I do understand how
Yeah.
someone could think that way at the age of 58 to say, I'm out. So you create an opportunity for these practices to be able to collaborate when it comes to all the boring stuff from
Yep.
HR and billing, then also opportunities for growth. If we kind of wrap up with you giving our community this message, who are you most looking to talk to? If someone was watching this on Facebook or see this on their, like, where in their practice owner journey should they be reaching out to
Yeah.
Weston and SPP?
Yeah. So let me set that up with something that I actually just thought about this, and
Yeah.
I was giving a lecture last weekend on culture building and stuff like that. But I actually used a quote. Well, it was a quote somebody posted on Dental Nachos. Like I saw it a month or two ago, and it was this. It's probably I'm assuming it got a lot of traction. It was the one. It says, "Hey, dentistry is hard. I'm exhausted. I'm only
Yeah.
37." And go. Remember that post?
Yeah. Yeah.
And it's
That's
so
one of our
true.
most
And he's
popular
like,
ones.
if I don't actively seek new patients, they'll go somewhere else. If I don't continue to plan fun events and celebrations for my staff, they leave. I'm working when I'm not working. That's not working for me as a parent, practice owner, and spouse. Dentistry is hard. I don't care who you ask, right?
Yeah.
That's who I want to talk to and be like, dude, I
Yeah.
feel you. I feel the exact same way sometimes. Like that never really totally goes away, right? Like that's just the hard stuff about being a business owner. So to say that's unique to dentistry, it's not. But what we can do is we can have more support. You can have more people than just inside your little space,
Yeah.
that are there to support you. I want to talk to doctors like that, that see where the industry is going and say like, oh, I see it. My friends and my colleagues are all probably joining groups.
Yeah.
I don't know if group is right for me or not. Come talk to us and find out if it is, because it is for some and it's not for others. And that's
It's
totally
also, I
cool.
want to share, it's also where you are in your journey. Just find out.
Correct.
the journey for you could be you're 3 years away from doing this. You want to do this in your
Yeah.
practice. The journey could be is I wish I met a group like this sooner, but you all from talking to awesome people. I so appreciate Weston, you supporting our community. We're going to do more awesome things like this. People can text SPP to 215-543-6454. I always say treatment plan your career for happiness, and I appreciate you helping dentists do that. Thanks for
Thanks,
sharing
Paul.
with us today.